Hello, my name is Julie Hill, and today I'll be talking to you about proton therapy. I myself am a radiation therapist, so I don't actually work in proton therapy. I work with electron and photon therapy, but proton therapy is another subset of what I do. So I thought I would talk to you about proton therapy today. So we'll start with what are protons. Protons are a subatomic particle with an electric charge of one positive fundamental unit. Next to the slide here, I have what an atom looks like. Neutrons have a neutral charge, and protons have a positive charge. They make up the nucleus, and surrounding that are the electrons, which have negative charges. In chemistry and biochemistry, the word proton is commonly used as a synonym for hydrogen ions or hydrogen nucleus in several contexts. So what exactly is proton therapy? Proton therapy is an emerging cancer treatment modality which utilizes a beam of protons to irradiate diseased tissue. And that's very similar to photon and electron as well. That's what we typically use. Proton is more of a specialty. So like all other radiation therapy forms, proton therapy, works by aiming energetic ionizing particles onto the target tumor. Due to their relatively enormous size, protons scatter less easily in the tissue. Beam stays focused on the tumor shape without much lateral dispersion and or damage to surrounding tissue, which is definitely a benefit and really nice. So the history of proton therapy. In the mid-1940s, Robert Wilson hypothesized that highly localized deposition of energy from proton beams could be utilized in increasing the radiation doses to tumors, while at the same time minimizing radiation to adjacent normal tissues. Shortly thereafter, scientists at Lawrence Berkeley Laboratory initiated the first studies on proton irradiation to confirm this hypothesis. So let's talk a little bit about the technique and kind of what it is for what proton therapy really is. So protons have a finite range, which is energy dependent, basically meaning that their energy has just a very short range. So it's like a burst of energy. So it's meandering along, burst of energy, meandering along. Whereas photon therapy and electron therapy is kind of gradually absorbed into the tissue. So with increasing energy deposition, with penetration, distance leading to a max, which is the Bragg peak, which is that energy boost, towards the end of a proton beam range. Dose peak occurs at the depth proportional to the energy of each particle. So that's kind of nice because you can control the depth at which this is actually delivered, this energy. Conformality can be achieved by adjusting depth of Bragg peak, thus a plateau of uniform dose can be precisely covered by the target area while sparing adjacent normal tissues. So the laws of physics to determine the absorption of energy from photons and protons are pretty standard. So I've included a chart of kind of how photon beams are delivered. As you can see, their energy declines as they are absorbed in the tissue. And then you see as proton beams, they kind of, like I said, kind of go along, and then they have this intense deliver of energy, and then it completely falls off. So the dose of the photon beam decreases exponentially with the depth in irradiated tissue. Dose of proton can be uniformly distributed across the target and is essentially just right at the target, or zero deep. Dose proximal to the target area, lower when compared with that of photon technology. I've also included here some pictures of different plans for a brain treatment, and you can see how the proton treatment is very conformal versus the protons where you can't get quite as much of a conformal look, and that's also IMRT. IMRT is also another way to do a photon treatment. It's a little bit conformal. It's actually very conformal, but it's not quite as conformal as what you would see in a proton treatment. So let's move on and talk about the equipment. So proton beam therapy uses a special machine called a cyclotron or a can't even barely say it myself, a synchrotron to generate and accelerate protons. The protons leave the machine and are steered by magnets toward the tumor. Other pieces of equipment are used to modify the range of the beams, proton beams, and shape the beam, and to compensate organ localization. The procedure is performed on an outpatient basis, and the average course of treatment is usually 5 to 7 weeks, but every once in a while it's just a few days. The length of treatment will vary depending on the tumor stage and size. The delivery of the proton beam to the patients only lasts about a minute, although the setup for that does take about an hour. And the way proton centers are set up, there's only one proton beam. So there are patients set up in different rooms, and you have to wait for the engineer to deliver you that proton beam because it's cycling around in the cyclotron, and it only can be delivered at once. It cannot be split up into different beams. So the conditions that we treat with proton therapy, AVMs, they're benign treatments of defects for the circulatory system, isolated brain metastasis, pituitary adenomas, and medulloblastomas, base of skull, the acoustic neuromas, which are benign tumors affecting hearing, chordomas, chondrosarcomas, tumors of the brainstem, meningiomas, and the eye, uveal melanomas, retinoblastomas. We also have the head and neck for the nasopharynx, the oropharynx. We can also treat the chest and abdomen, chordomas and chondrosarcomas, excuse me, and early lung stage cancer. For the pelvis, it's the same thing, chordomas and chondrosarcomas, prostate cancer, which is a big one. A lot of people go for the proton centers for prostate cancer right now because they want to minimize their side effects. Tumors in children, especially brain tumors, that's number one. And then orbital and ocular tumors and sarcomas to the base of the skull and spine. Proton therapies cannot treat all malignancies, though they are limited. Proton radiation is a local treatment, and the ability to treat malignancy is limited to the primary site. Cannot be used to cure cancers that are systemic, basically throughout the entire body, such as leukemia or cancers that have metastasized to other parts of the body. So let's talk about the advantages and disadvantages of proton therapy. The advantages are it delivers a superior targeted dose coverage while sparing normal structures. Lower doses to healthy tissues have less severe collateral side effects than conventional radiation therapy, and it results in less chance of reoccurrence. Minimized normal tissue injury usually results in fewer and milder side effects such as nausea, vomiting, diarrhea, and leads to a better quality of life during the treatment. So, disadvantages. The diseases for which lower doses and wider fields are indicated, the role of the proton are limited. Primary use on cancer that is metastasized considerably more than expensive, and is way more expensive than radiation therapy. So I've included a chart which I kind of agree with and disagree with at the same time. It kind of shows you the difference between proton therapy, chemotherapy, and radiation therapy. I, working in the field, will tell you that I do believe that photon therapy is not really going anywhere. I think that proton therapy definitely has its benefits, especially in children's cancers and things like that. One thing I will tell you, and kind of an analogy that I use, is when you're using photon or electron treatments, you're treating a bigger area. You're including more of the healthy tissue, yes, and you will have some side effects from that. But at the same time, you don't know where every little cancer cell is. We call it cleaning out the dust bunnies. So sometimes you want to irradiate a little bit more than you would normally irradiate so that you make sure you get all those dust bunnies and all those bad cancer cells out. Sometimes with proton therapy, like I would say for prostate cancer, which is a big selling point right now, a lot of people like to do it for prostate cancer because they think they'll have less side effects, which is true. But in the end, it does make me a little nervous that you might be missing a couple of those little cells because it is such a targeted treatment versus photon therapy, which you're getting kind of more of the entire pelvis, and then you're focusing down in on just the prostate. So what's the future of proton therapy? It is believed that with clinical research in proton therapy that it will likely become the cancer treatment choice of many patients, which I think is true. It will definitely be their, probably what they want the most. But again, being in the industry, I think that the benefit isn't really there for all cases. I think it's more of a specialty case thing. And also the price of proton centers is enormous, and the price of the patient is enormous. So I think it's kind of just going to be limited to specialty things, but technology grows, so you just never know what's going to happen. The future of proton therapy also depends heavily on clinical research over the next 10 years to improve the effectiveness and ability of this treatment. So we'll kind of see where it goes. The centers are expensive, they're very large. So we'll kind of see where it goes and if the benefit outweighs the price. So thank you again for joining me today. If you want, I've included a video of kind of how proton therapy works. If you just want to check it out, you can click on the link for the YouTube video. And And I've also included the bibliography. So thank you so much. Bye-bye.